Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, March 3rd. We are joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Once again, our sign language interpreter, Mary Thiessen, is with us, and André Boursier from French Language Services Directorate will provide French translation. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin, I would like to verify that everyone can hear us. If any one of the reporters are having problems, please email ecoinfo@yukon.ca. Premier Silver?
Thank you very much, Pat, and thank you everybody for joining us here. It's great to be here with Mary and with Dr. Hanley and the team here on the traditional territory of the Taanquatching Council and the Kwanlin Dun First Nation. I'm very pleased to report that we continue to have 0 active cases of COVID-19 in the territory. This is very comforting news, and again, I want to thank all Yukoners for continuing to take all of the necessary precautions to keep each and every one of us safe. Practicing the Safe 6 and also masking up is still an incredibly important part of the equation as we deal with this pandemic. Last week, we received a large shipment of vaccine doses. The general clinic opened up in Whitehorse on Monday for all residents age 18 years of age and up, and they have also provided the second shots to those who are over 60 years of age. It is absolutely wonderful to see the clinic open, and I want to thank all of the nurses, the staff that are working there, and thank the residents of Whitehorse for their patience. By all accounts, the clinic is operating smoothly and effectively. The mobile teams are continuing to travel back to the communities to provide the second shot. They are in Dawson City and Carcross today, and will be in Pelly Crossing on Friday, and continue returning to other communities next week, including Carmax, Burwash Landing, and Destruction Bay, Faro, Haines Junction, Mayo, and Ross River. If you live in a community and did not get a shot the first time around, you still can get your first shot when the mobile clinics come through, and I strongly encourage you to do so. We have enough vaccine doses for everyone who wants a shot. Contact yukon.ca/thisisOurShot to book an appointment. At the end of Monday, 11,503 Yukoners received their first shot, and 5,665 have received their second shot. The clinic here in Whitehorse has been immunizing more than 850 people each day. And on Monday alone, we delivered more than 1,000 shots. So we anticipate that these numbers are going to steadily increase in the coming weeks. The vaccine rollout is well underway, and the uptake has been fantastic so far. Thank you to all Yukoners who have received their shots and who have spoken on social media as to the importance of why they are getting their shot. And I encourage all Yukoners who haven't yet, please, get your shot. The vaccine will keep our territory safe and healthy as we look forward towards spring, and our goal is to immunize as many adult Yukoners as possible. Yukon has been able to roll out the vaccine to citizens at a greater per capita rate than most other Canadian jurisdictions. While others are just beginning to vaccinate seniors this week, Yukon is many months ahead and have already beginning to administer doses to the general population over the age of 18. As Dr. Hanley has said, the vaccine is our pathway out of this pandemic, but it will take time. There are still many unknowns on our path forward, including variants. It's very important that we continue to minimize the risk of importation and transmission of COVID-19 in the territory. The controls at our borders and the requirements for individuals to self-isolate for 14 days upon entry into the territory are authorized under the state of emergency. As of today, we have extended the state of emergency for those reasons. This is not an indication of any increased level of risk in the territory. Extending the state of emergency allows us to continue to enforce border controls and self-isolation requirements to protect Yukoners. In the past week, 4 new charges have been laid under the Civil Emergency Measure Act, including 2 for failure to issue a declaration when entering the territory, 1 for failure to self-isolate as required, and 1 for failure to wear a mask. We will continue to enforce these measures as necessary to keep all Yukoners safe and healthy. The state of emergency can also be lifted at any time if it is no longer required. We continue to monitor the situation and to adapt as necessary. As long as the pandemic continues to pose significant risk to our health and safety and livelihood of Yukoners, we will take action to protect and support them. We will continue to follow the recommendations of Dr. Hanley and his team. As the vaccine rollout continues to ramp up, please continue to support one another, be kind and patient, keep up the good work, everyone. I do want to do a very, very quick shout out to my new friend, Clem Campbell, who gave me this pin. Clem is from Prince Edward Island and is raising money for the Cancer Society, and he wants to remind everybody that even though you're wearing a mask, you still should be smiling. So thanks, Clem. I really appreciate the pin. Thanks to Premier Dennis King for involving me in that. Off to you.
Thank you, Premier Silver. Dr. Hanley?
Thank you. Good morning. Bonjour. Bon matin. As the Premier said, I'm also pleased to report that Yukon remains steady with no current active cases in the territory. And I, too, am grateful for Yukoners continuing to be so vigilant with the Safe 6+1. I know we're all becoming tired and sometimes may be dismissive of the public health measures in place. But let me assure you that by following these measures, we have been able to maintain a low number of cases throughout the past few weeks, and our efforts continue to pay off. Though in general we've seen lower case counts in Canada in the past few weeks, we've also seen jurisdictions across the country hit hard recently. Our friends in PEI are currently under a 3-day lockdown. Quebec maintains their curfew. Ontario continues to enforce stay-at-home orders. And Yukon has been able to avoid taking these stricter measures because all of you continue to comply and take a cautious approach when you need to. Our collective efforts and vigilance help reduce our risk, but it's also by looking after each other that will see us through these uncertain times. I know how many feel. You're exhausted, maybe doubtful and unsure of what our next few months will look like. But if, for a little while longer, we can muster the energy and continue to follow the Safe 6+1, receive our vaccines, take all necessary precautions, we continue to move closer to closing the door on COVID. But closing the door on variants is a tougher challenge and a new one for us. The threat of variants is real. And when we look around the country, there are signals that things could get worse due to variant transmission, particularly the B117 variety. BC yesterday, for example, reported an increase in cases and an increase in hospitalizations. Rising variants of both the B117 and the B1351 are reported. Some of these variants do not have a known travel connection. If cases, and particularly variants, lead to increased COVID activity, our risk of importing variants will go up day by day. So while we face this risk, we can also profit from the opportunity to get our vaccinations before the variants find their way to the territory. For now, we're in a good place. No active cases, and the vaccine clinics are going full tilt. The Moderna and the other COVID vaccines continue to demonstrate success in offering a strong layer of protection against the original COVID-19 virus, and Moderna appears effective against the current variants. We continue on our path towards vaccinating all willing and eligible Yukoners. And as the Premier said, as of yesterday, over 11,500 people with first doses, over 5,600 people with second doses in Yukon. This is extremely promising, but we still have a distance to go while we administer the second doses along with new first doses. Team Togo and Balto are returning to Carcross, Dawson City, Pelly Crossing, and Teslin this week, and Team Fox remains focused on Whitehorse. This week, we have officially begun to vaccinate the general population of Yukon. On Monday, the first day, the Convention Centre Clinic was filled with excited faces, ready to receive their first dose of the vaccine. The turnout thus far has been impressive, and I hope this will inspire others to book an appointment over the coming weeks. More than 850 individuals were immunized in the mass clinic yesterday. Appointment slots for the upcoming weeks remain open for those who are not able to book a time this week, and we will continue to work to safely administer vaccine into arms as quickly as possible. As I mentioned last week, I will be lining up to receive my shot later this afternoon alongside my colleague and friend, Dr. Elliott. I personally feel very lucky to receive my vaccine today. How incredible to think that we are here a year after COVID-19 was declared a pandemic. I know many of us have been talking with family and friends outside Yukon who are amazed at the access to vaccine that we currently have. We know that there are very good reasons that the territories received a higher allocation of vaccine. We live in remote areas with limited access to specialized care. There is legitimate concern about the risk of worse outcomes from COVID in Indigenous communities. So while we recognize that immunizing the territories is the right thing to do for Canada, this incredible opportunity should provide us with extra motivation to step up and get the vaccine. As we continue to progress with our journey to vaccinate Yukoners, we are looking ahead to a point where we can safely travel, gather, and recover from this whirlwind of a pandemic. I think we now all realize that getting there is not quite as simple as we had once thought, but we cannot get there without vaccine. Adhering to self-isolation when required, getting tested when symptoms occur, staying home and away from others when sick, and of course getting immunized when the vaccine is available will put Yukon in an even better place as we move towards spring. Looking back to last year, once spring arrived and people were able to get outside, we were able to gradually reduce restrictions that had been in place to protect us all. Once we achieve the goal of vaccinating a majority of Yukoners, there will be some flexibility with the current public health measures in place. And what is that magic number, that majority? All we know now is that the more, the better. Our goal is 75% of the adult population, and the closer we get to that number or beyond, the more confident we can be on our ability to safely ease up on restrictions. Easing up means the ability to expand our social bubbles and social gatherings. We will be able to connect more fully with family and friends once again and increase our gathering sizes when it's safe to do so. As we approach summer, we hope that we will be in a place where we can gather with larger groups and outdoor events, hold picnics and camping trips while celebrating our community, the arts, support local businesses, and meet each other at festivals and markets. This also may include reducing current restrictions so we can expand important ceremonies such as potlatches, funerals, celebration of life, and weddings, while keeping them safe. As we progress over the next few months, we will continue to monitor COVID activity while holding frequent conversations with our provincial and territorial partners to discuss our next steps. Once we can be confident that COVID risk has diminished and vaccine rates are sufficient, we can begin to open the doors to more travel throughout Canada and eventually beyond. Eventually also we will be able to welcome our loved ones with open arms, reconnect in person instead of through video and telephone. These are not changes for next week or even next month. Even setting a date is difficult at this point, but these times are within reach. We will see a difference over time. we will be able to reintroduce certain things to our lives we have been missing throughout the past year. And every day we are one step closer to reaching post-pandemic life. So let's continue to push through these difficult times. We are close to being where we need to be. Please be patient, be kind, and hang in there. And that's all for my update. Thank you. Remember to take care of each other and stay well. Merci Cho.
Thank you. We'll move now to the phone lines, and we'll begin with John, CKRW.
Hi. My question is for Premier Silver in regards to the upcoming territorial election. I know that you've just announced that the state of emergency is going to remain in place for another period of time. I'm curious as to what that means for the upcoming election, as will you be calling it during a time when majority of the territory has been vaccinated, or some of the health restrictions have been moved back, or what's the plan?
Yeah, I'm not here to talk about an election. I'm here to talk about keeping Yukoners safe from COVID today.
Thank you. Next question, John. John, do you have another question? Hearing nothing, I'm going to move down to Steve from CBC.
Hi, yeah, my question is for, I guess, Mr. Dr. Hanley. Last week, there was no clear indication from you about the vaccination rates in the communities. I was wondering if you could clarify the rate of acceptance of the vaccine among people in the communities. I know you've been saying it's going well and that kind of thing, but it's not very specific. I was hoping we could have some numbers, please.
Yeah, I don't have numbers for you specific to communities. That's still an ongoing conversation, and I think I referred to the sensitivity around revealing specific community numbers, as well as some of the, there are many ways to report numbers and to establish what the denominator is. So there's still a work in progress on both confirming numbers, but also confirming with communities. And I think that the release of community data will be up to the specific communities. And what I said, I don't have an updated number from that overall average from the communities. That we said for that first sweep through the communities was 53%. What we are seeing with the second round is lots of people coming forward for the first round. So clearly we're going to get substantially higher than that 53% uptake. So I'm really looking forward to getting those numbers myself. And once we've done the second sweep of the communities, we'll have that community, at least that community a specific number, potentially some regional numbers to share as well.
Thank you. Next question, Steve.
Okay. So I don't really understand the sensitivities with releasing numbers of how many people got shots. I don't see how there's any privacy issues with that. But whatever, I guess journalists will just ATIP it, but it just seems kind of inefficient when the numbers could just be released. But for my second question, I see that there's a no photo and video policy for the vaccine clinic in Whitehorse. Can you explain why that is, and if it's any different in the communities? Politicians, including ones you work with directly, posting photos from inside the clinics in the communities of themselves, and others also appearing to be waiting for a shot. Are there exceptions for politicians, or are there different rules in the communities versus the city clinic? And also, if you're going to say it's because of privacy, can you explain how much privacy one can expect in a room with about 100 people or so who can all see each other quite easily, please?
As far as individual Yukoners taking photos, that's one thing. I believe that the guidelines that Dr. Hanley provides to us through his recommendations, whether it be for vaccination clinics or for hotels or restaurants, are based upon keeping people safe. I'm very happy to see people in my community of Dawson, when they get their shot, taking photos and explaining to people why it's so important to get vaccinated. But I could understand why the doctor and his team would recommend, as far as extra access to people in these media and others in these clinics, when we're trying to get thousands of people vaccinated per week, would be a concern as far as limiting the sizes of gathering, limiting the amount of people in those clinics. The folks that work, especially at the Whitehorse Clinic, they work extremely hard, and they're very, very dedicated to their craft and to keeping Yukoners safe. And I believe that would be the discrepancy between not wanting journalists in to go through this. But again, I don't know if Dr. Hanley has anything more to add about that. But I would understand it would be the sheer volume of numbers of people in the clinics.
I don't think I have much to add. I think it really is all around, the recognition that there are, up to 1,000 a day being processed. There are obviously the need to respect the COVID safety protocols, and to keep everyone feeling that they're in a trustful environment. So I think it's as simple as that.
Yeah.
Okay. Premier Silver.
And sorry, I'd just add as well, when you do see Minister Frost or myself with elders, other community leaders, taking pictures, our goal is to show folks this is safe. Our goal is to showcase leaders in the community leading by examples, whether that be our elders, our mayors, our chiefs, and having conversations with Dr. Hanley as well about making sure that we do that in the safest manner possible. I think it's really extremely important that we do have that social media presence, and we're showing that that it's extremely important to us as leaders as well to roll up our sleeve and to work as a team. And I think that's the big thing. Yukoners have shown us throughout this whole vaccination process, throughout the whole COVID-19 pandemic, that we are team workers, and we're willing to fight this virus at every turn. And Yukoners obviously are they're not strangers to being team workers or to being fighters. Just look at Dylan Cousins last night.
Thank you, Premier. We'll move now to Tim, Whitehorse Star.
Yes, hello, thank you. So my first question is for either the Premier or Dr. Hanley. I realize you say you don't have the numbers on vaccine uptake, but you've said that the uptake is really good. You did, 800 and some people here in the Whitehorse Clinic on Monday. Do you think there's any danger of overselling the vaccine? It seems like people are more than willing to take it up, but you're flogging it like a dead horse. Are you trying too hard?
It's an interesting question. We'll continue to promote the efficacy and safety of a vaccine. And there's some really interesting information coming forward about AstraZeneca. We're seeing chief medical officers of health working extremely hard right across the nation to provide the most effective scheduling of vaccines right across Canada. I know people are sick of talking about COVID, but we definitely believe that it's extremely important for us to get the most up-to-date information out there, and it's an ever-changing world. I just talked with Dr. Hanley yesterday about vaccine schedules across Canada, and the information we had a month ago compared to the information we have today. It's a moving target, and I don't feel like we're flogging a dead horse. I feel like it's our job and the media's job to promote the most up-to-date information about vaccine schedules, vaccine efficacy, and the scheduled appointments. But also, it's really important that Yukoners keep on promoting the reasons why they are rolling up their sleeve and getting this vaccine. We have international conversations about passports, COVID passports, and vaccine passports. Our goal is to not have to get there. Our goal is to make sure that enough Yukoners get the vaccine so that we don't have to have those conversations. Right across Canada, every premier and every chief medical officer is doing the same. We really do need people to get that vaccine. Maybe there's people out there that normally skip every second year for a flu vaccine. Those types of things, come up with reasons for like I never get sick. So I'm having those conversations with Yukoners right across the territory. Most people understand how important this vaccine is, and most people are doing their due diligence to get the most up-to-date information on these vaccine options. And we will continue to promote that. And I don't think it's flogging a dead horse. I think it's us doing our job to make sure that we keep Yukoners safe.
Dr. Hanley?
Yeah, I'll add a couple of things. I agree with what the Premier said, and I think, just as we try to anticipate where the risks are going to be tomorrow and next week and next month in terms of our COVID response, I think we also have to keep ahead of the vaccine information and stay on top of it and keep ahead of it and be able to talk about what we know. I get questions about vaccine every day, and I know that there are people who are hesitating. We know that we've had success stories with people holding back the first time and coming around for the second time for community visits, for example. But vaccine hesitancy is a reality, and the more we get to understand and know about it, the more we can address the questions that people have and give them the information that they need. So this is real. I think the worst thing that we could do would be to just sit back and let people kind of flood in, because eventually that flood will stop, and we will be left with people who have questions. So that I think the more we can address, anticipate, stay on top of those questions, the more comfortable people will feel coming forward for vaccine.
Thank you. Do you have another question, Tim?
I do, and this one is probably more for Dr. Hanley, especially considering some of what he just said. I'm not quite sure that I or other people understand why it's so difficult to put a framework in place. For instance, we had 4 weeks of not having an active case here, and then we had a couple. Why can't you put a framework in place that says, okay, after 4 weeks of not having any active cases, we can do this to perhaps loosen some of the restrictions, or after 2 months? Why is it so difficult to not be nebulous about what's going on?
Yeah, I'm going to take up that word nebulous, because we are kind of in a nebulous time, and even this morning, Dr. Tam, the Chief Public Health Officer, was talking about rising cases in Canada. So for the first time in a while, verbalizing what we are seeing, and if we look closely at some of the 7-day rolling averages in jurisdictions, we are starting to see an uptick. And we are seeing variance increasing, and I think this is a really, this is not a theoretical phenomenon. What we're seeing right now is what the Public Health Agency modeling in February was predicting, that with the current measures staying as they were last month, that with the rise of variants and the known doubling time of variants, we would start to see increases in COVID activity. This is a huge consideration for us, because regardless of whether we have 0 or 10 cases right now, we are always managing risk and risk of importation, and that risk of importation has gone up with COVID activity in Canada, has declined somewhat, but is in danger of coming up again if we see a rise in COVID activity as a result of the rise of the variants. I'm very concerned about what's happening in the U.S. with some of the states that are opening up widely and setting a kind of a precedent for opening up in the face of what's burbling underneath, which is the rise of variants. So this is a real risk. Our strategy has always been risk-based, and we are assessing those risks while we think forward to if we get to a point where confident variants are under control, COVID activity is under control, then we have lots on the table that is in the planning. Also depending on the vaccine uptake, and so that's why we're flogging vaccine uptake. It's so critical to getting to a place where we can be much more confident about being able to then to propose a solid framework for opening up.
Premier Silver?
Yeah, I think the best analogy for here is it was only a few short weeks ago that we would say things here at the table like, we're not out of the woods yet. We can see a light at the end of the tunnel. Now we're in a situation where we see the finish line. But really, it's the variants, especially the South American, the Brazilian variant that we're still monitoring right now, and to see what the effects of these vaccines and boosters will be. But that is, there's variables we can control and there's variables we can't control. And that's an extremely important piece, is understanding the variables, the variants. I'm cautiously optimistic from what I hear from Dr. Hanley and the team, but really we're not going to speculate at this point. We will have more language very, very soon, if not today or tomorrow, on where we are on the path forward, a more understanding about what we can do and what we can expect with best science to date today, and hearing great things out of other jurisdictions in Canada. It was just only a week to 10 days ago where there was still speculation as to vaccines rolling out over the next few years, and now we're back on that schedule again, and I think we always have been on that, so that Canada-wide, September is the date where we're really starting to see, at least by September for the rest of Canada, for vaccinations. So, I wish we could come out here right now and say that the variants aren't a concern for Yukon because of the low cases, but that's just not where we are. We need to get more information on those variants, and we also need to update Yukoners on what we can do once Yukoners get vaccinated.
Thank you. We'll move to Laurie Roboreal.
J'ai pas de questions, merci.
To Camille, Canadian Press.
Hi, thank you for taking my question. I'm still not clear, Premier and Dr. Hanley, on why you're not releasing the percentage of the eligible population that has had its first shot and second shot. Am I right in that, or am I confused?
Yeah, so last week, I believe, 2 weeks ago when we were both here, I wasn't here for last week's update, Dr. Hanley did release the average of rural vaccination. Our hesitancy here to say specific communities had more or less, or what the mean is, or the standard deviation around that mean, it really is, pitting one community against another as far as why people speculate as to why one community got less or to the other. So I think what we've done is very respectful to the leadership in those communities. We've shared those individual numbers with mayor and council, chief and council, leaders in the communities, and so they have those numbers. We'll continue to share the mean data as far as uptick, because that's important information. But I don't think that, pitting one community against another community as to one got 60% and the other one got 55%, and then having everybody speculating or pointing fingers, I don't think that that's necessarily going to help the safety of Yukoners. The number as a mean is extremely important. Knowing full well that we have goals and targets of 75%, we have vaccinations available for everybody who wants it, and to continue to promote us maximizing that number. And my extreme respect and gratitude goes out to chief and councils and mayor and councils that have been helping us in every community to maximize those numbers. We will leave it to them to do what they need to do to promote everybody who can get that vaccine to get that vaccine, and we'll continue to update the numbers on the averages for rural Yukon.
Dr. Hanley?
I think the only thing I'll add to that is that, my goal, I think the most important goal is Yukoners getting vaccinated, and that means people living in Yukon regardless of where we are. So that really is the primary goal, and we're all working together on this. We have communities sharing ideas and thoughts and experiences, and this has been extremely valuable from one community to another. We have leadership involved, whether that's municipal or First Nations leadership, helping out each other. This is a collective goal, and we're all in it together.
Thank you. Camille, do you have a second question?
Yes, I'm sorry, but I'm in Vancouver, and so I'm not very familiar with what's really going on there. So I want to make sure I understand you correctly. So you have released the vaccine uptake figures for the whole territory, have you? But you don't want to release them for communities, is that correct?
So we have released that to date we have total vaccinations of 17,168 vaccines, which is first doses 11,503. Sorry, Mary, I'll slow down with my numbers. The total was 17,168 vaccines in total, but that's first and second doses. And so first doses is 11,503, and second doses to date are 5,665. We've also released numbers for rural community as far as uptake of their adult population that have received the vaccination. What we haven't done is breaking that data down to specific communities. Watson Lake versus Beaver Creek versus Dawson, that type of thing. So we've definitely have the numbers out. We will continue to give the numbers and averages, and we will respect the individual communities to either release their individual communities' specific percentage of the adult population that's been vaccinated or not, based upon their leadership.
Thank you. We'll move to Haley, Yukon News.
Thank you. I had a question about sort of promotion of the vaccine, particularly through social media. We've seen some jurisdictions around the world offering sort of selfie stations for people who get the vaccine. I've noticed Yukon released Instagram stickers that can be used by people using the social media platform. Either Premier or Dr. Hanley, could you speak a little bit about that decision, I guess, asking people to promote their vaccination over social media and giving them these tools to do that?
Yeah, I think Dr. Hanley will have maybe more to say about this than I do. To me, it's from the very beginning, before we even started promoting that type of social behavior online, we were seeing it from individuals in communities, like people just kind of showing up and saying, "Look, this is why I'm taking my shot," and the answers and the responses that we're getting were they're amazing. Elders talking about, I'm getting my vaccine for the next generation, for the youth. Other people having other reasons, and we just are riffing off of the goodwill and the good nature of Yukoners that are out there promoting. I'm seeing folks from Haines Junction, doing updates on our update. I'm seeing people in every community really sharing the most up-to-date information. Again, mayors and chiefs on their social media feeds talking about the importance of scheduling and not just showing up. And so anything we can do to help in social media. I'm pretty horrible at social media personally, but I know that the team at Health and Social Services, working with the comms teams that we have really riffed on promoting what Yukoners are doing anyway, and just making it more, trying to facilitate that conversation, saying, yes, please keep on promoting your individual reasons as to why you believe that we should all be vaccinated.
Other than getting Pat living up here or my 15-year-old daughter, I'm not quite sure what I would add, but I do think that's the sentiment.
Thank you. Haley, do you have another question?
Thanks. No, I don't have another question. I'd also like some more detailed numbers, but my colleagues have already addressed that, so thank you.
Thank you. We'll move to Claudiane, Radio-Canada.
Okay, so I'll ask my questions in English, but I would like answers in French as well. I'm just thinking this might be of benefit for my colleagues. So first question will be, so you say the second round in the communities is bringing people in for their first shot. So I'm assuming that there will be a third round in the communities, or is this going to be ongoing vaccination clinics going into the communities so that people can, as they decide to get their first shot, can get their second shot? Like, this is an ongoing thing?
Oui, merci. Je peux expliquer peut-être que oui, il y a ou une troisième visite ou un plan spécifique pour la communauté. Et ça dépend de le nombre de personnes qui ont besoin de vaccin, la capacité de communauté, la présence de santé publique dans la communauté. Donc, c'est dans l'étape de planification maintenant pour chaque communauté. Mais ce qu'on veut emphasiser peut-être, c'est que les personnes, les gens sont bienvenus pour recevoir leur première dose avec la deuxième visite, et on va assurer qu'il y aura les moyens pour accommoder la deuxième vaccin. Et s'il y a les gens au futur qui viennent plus tard, on va toujours essayer de faire des plans, des moyens pour accommoder aussi cette personne. Mais le plan spécifique, ça va dépendre de plusieurs facteurs. So I'll just repeat that in English. That so we are welcoming people, and this is really important. We're welcoming people to come for first dose on the second dose visits, the community visits, and those people will either be accommodated on a third visit, or there will be plans specific to that community, and it really depends on the number of people, and it depends on the size and the capacity of the community and of the nursing staff and public health presence in that community. So, for instance, it may be as simple as sending a vial of Moderna or two, and having the immunizing staff immunize, because every community does have staff who are able to immunize. But in some cases, if the number is substantial, it may make more sense for a short focused visit by a mobile team in the future. So those are the kind of arrangements that we're working on. And yes, if there's a third visit and people are still coming from the first dose, we will make sure that we have ways and means to accommodate those people for their second dose as well. Everyone who gets the first dose, we will make sure that they have access to a second dose.
Thank you. Do you have another question, Claudiane?
Oui. So we have been kind of following numbers, and the numbers that I have been provided was that the 75% of Yukoners vaccinated equaled 25,200 people. That was the goal, and I just want to confirm that this is still correct. So we are now at 11,500 or so we're roughly approaching the 50%. I just want to confirm that for all of Yukon, what the uptake so far has been. I mean, this is first dose. I realize that we need the second dose, and want to confirm that. So once we hit the 75%, you say you're hoping not to have any COVID vaccination sort of certificate to be able to travel around, and I'm guessing there is some discussion happening with the other counterparts in the country as to when movement will be possible between provinces, or when we can go back to basically normal. And just want to confirm again that will happen according if things stay the same right now. I realize that would happen at the 75% mark, right? So when 25,200 Yukoners get their two shots, are immunized, we could see some normalcy coming back. Is this correct?
Yeah, I'll just do a few clarifications and then I'll let the good doctor get into more specifics. 75% was the number that was used Canada-wide at that time to basically say that this is what herd immunity would probably look like, 75% of the population. And so we always use that number. Now, the federal government also did commit that, if we got past 75%, like there will be vaccines available for Yukoners even past that threshold. But that was kind of the line drawn in the sand from an epidemiological perspective early days, and it's continued to be looked at, and Dr. Hanley and I have talked a lot about whether or not that 75% holds. And so, again, just to clarify, we will have enough vaccines for anybody who wants it over the age of 18, and we're seeing some great things with AstraZeneca, and we don't want to limit to 75%. If we hit that threshold and we want to continue to vaccinate, please continue to show up. And I think really right now, Claudia, and this is a really good question because it's clarifying all the information that you've been paying attention to for the last year. Right now, the big unknown is the variants. So as we continue to affect the variables that we can control, which is to try our best to get people vaccinated in Yukon and maximize that amount and work with the federal government to make sure that we have that vaccine distribution schedule ironed out and ironclad, we still need a few to several weeks to figure out the variants and to figure out whether or not what we're seeing in Brazil, if our Moderna vaccinations and boosters are able to accommodate those strands. So to me, there's kind of two parallel conversations going on here. We don't want to talk about a passport necessarily, but we do want to see right across Canada as many people getting vaccinated, because that's the best thing we can do in the toolbox that we have to increase our ability to get back to normal. However, with a particular variant, there are many unknown questions right now. So. I'm cautiously optimistic, and I'm not a doctor. So I'm going to continue to rely on the recommendations from our amazing medical team right across the country and how they partner and share information when it comes to the variants specifically.
Maintenant en français. Oui, je peux dire pour le moment que 75% c'est le but, le cible. Et ça, comme le premier ministre a dit, c'est le nombre selon ce qu'on a était l'accord de distribution de vaccins du Canada. Donc c'est une cible qui est partagée par tout le pays. Et ça, essentiellement, c'est le nombre de vaccins qu'on a. Et si on va jusqu'au le 75%, on a aussi l'opportunité d'aller plus loin, jusqu'au 85% ou même plus. Donc on est assuré qu'on a assez de vaccins pour chaque Yukonais, chaque adulte Yukonais à ce moment qui veut recevoir le vaccin. Donc, qu'est-ce qu'il y a le nombre magique pour avoir immunité dans la population? Et ça, c'est un nombre qu'on ne sait pas. Ça peut être le même, ça peut être vers 70-75%. Et avec plus des semaines qui passent, avec plus d'évidence, avec plus des études, on va éventuellement arriver à une estimation de le nombre qu'il faut pour avoir assurance d'immunité dans la communauté. Et ça va être peut-être un deuxième but pour arriver. Peut-être ça sera moins de 70%, peut-être ce sera plus. Et comme le Premier ministre a dit, ça dépend aussi de l'influence et circulation de variants, parce que ça influence aussi l'effet du vaccin contre le virus. Oui, donc essentiellement c'est ça. Just to repeat that, our goal is for now 75%. if we reach that, we have the opportunity to have more vaccine to offer to every Yukon adult who wants vaccine, and we will eventually know. We expect with increasing and accumulating evidence that we will know what that magic number is for herd immunity, and then whether we will get there or not.
Thank you. We'll just circle back just in case. John from CKRW, are you still with us? And hearing nothing, then we will thank everyone for their time today. The next COVID-19 update will take place on Wednesday, March 10th at 11:30 a.m.